A grim, ghastly ambience welcomes you to Busolwe General Hospital in Butaleja district in eastern Uganda. To the right, eerily stands the hospital complex, constructed during President Idi Amin's reign in the 1970s, which has barely had a fresh coat of paint. Everything at the hospital is symptomatic of the country's ailing health sector, long ignored by policymakers who routinely frequent private health facilities or fly out of the country to receive treatment at first world hospitals. The rot extends to the staff quarters and other infrastructure such as oxygen cylinders, x-rays and beds. A rusted weave sweeps the hallways, and inside, the hauntingly rickety wards, ceilings and leaking walls appear on the verge of collapse. The hospital's mortuary was closed years ago after wild animals scoured the area for corpses. The health workers we found on duty were visibly lethargic. There is no reliable electricity supply, no basic health equipment. There is also an acute shortage of specialists and frequently drugs. Health workers who spoke off-curve told NTV they only do what they can to ensure the safety of the patients. When they face difficulty, patients are referred to the far-flung Mbale Regional Referral, which is 73 kilometers away. The newest complex at Butaleja Hospital was constructed by the UK Prime Minister's envoy to Rwanda and Uganda, Dola Popat, in memory of his mother, who was among the Indians expelled by President Amin. The Health Ministry was supposed to equip the 40-bed facility, which cost 540 million shillings, but this project has turned into a white elephant as the facility is now serving as a temporary mortuary. As Uganda joins other countries around the world on Friday to mark World Patients' Day, officials in the Health Ministry, long dogged by internecine fights and disjointed planning, have a lot of soul-searching to do. The United Nations in 2019 designated every September 17th as Patients' Day to enhance the global understanding of patient safety, increase public engagement in safety for both patients and caretakers. The country marked the day quietly last year, like elsewhere, by lighting the Ginger Cable Bridge in orange. The Acting Commissioner for Standards, Compliance and Patient Protection in the Ministry, Dr. Martin Sendiona, told NTV safety has been a long-standing issue.
The first is concerned, very much so. Overcrowded facilities, and you see them, people suffering, coming from far, sleeping on the veranda, and so on and so forth. And of course, in the regional fire hospitals, they are also they are congested, a number of them. So I think of course the best way forward is to improve the services in the lower level facilities.
He says that a lot is being done.
Also, you need also to appreciate what's being done to improve the quality of health services. The regional fire hospitals, a number of them have been refurbished, and even general hospitals with the new infrastructure.
The minister will tell you how many millions of dollars they have invested. But the question is this already translating into the safety that we ought to be seeing? I don't think that we are yet there. But even when you have these new facilities, do these facilities actually have the basics that are required for ensuring that patients are safe?
The World Health Organization defines patient safety as the prevention of errors and adverse effects to patients associated with healthcare. But day in, day out, stories are abounding of an assault of either a patient or health worker here, or medical negligence and wrong diagnosis there. Then there is the broken health infrastructure which cannot offer proper services to patients. This is Vincent Muziki, a 70-year-old resident of Botogo, a backwater in Buseru Parish, Bondobojo district. He had travelled to Bundubujo General Hospital to seek treatment. He was diagnosed with acute respiratory complications which are weighing down the functionality of his kidneys. Lungs and kidneys participate in maintaining the acid-base balance in the human body. Doctors recommended him for an advanced scan he can barely afford. The hospital's 1970s model CT scan and its parts, which was donated by the Japanese government, broke down 3 years ago. The machine served an average of 12 to 15 patients daily.
I know we have made lots of communications about this X-ray. The last time we made a very, very serious communication was during the first wave of COVID, because we realized that in COVID, sometimes X-ray is part of an investigation that's required. So I remember that time DTF even wrote a letter. They instructed DTO to ensure he writes a letter that goes to the ministry, and I'm sure all those communications have been received.
The hospital doesn't have specialists, routinely having to refer patients to Fort Portal Regional Referral Hospital, which is 83 kilometers away.
There are those that even don't come because they have failed to raise the money to go to Fort Portal, so it is really a big problem. Recently, I think about 3 months ago, there is some provider who came around, a private provider who is offering X-ray services within town, just a few meters from here. But I tell you, the cost is around 30,000. If it is cheap, around 25 to 30,000. This figure looks maybe small to some of us who can earn something small, but to a common person from the village, 30,000 is not anything small.
We spent a day at the hospital, but the ambience is quite depressing. The sight of patients and caretakers jostling for space and the visibly overworked health workers show how dire the situation is.
I know you must have seen the hospital is very crowded. You have numbers of patients. As I told you, it's the only hospital in the region, in the district. So all facilities, all lower-level facilities in the villages and the communities refer here. And so it's not surprising that we find very many patients.
There's work being done, but I think the challenge is that the gap is still big, and we have to prioritize within the resources available to see what can be done.
But the environment is not any better elsewhere. At the Uganda Cancer Institute in Kampala, usually one has to part with some money to get better treatment. On most days, ailing patients who have travelled long distances may have to find accommodation on the concrete slab to be able to queue up the next day. At Gombe General Hospital in Butambala district, the sight of patients and caretakers improvising where to sleep is a common sight. At Arua Regional Referral Hospital, a psychiatric ward was last year turned into a containment area for COVID-19 patients. Then the psychiatric patients are housed with patients in the ENT ward. The result has been near anarchy. Moses Mulumba, the executive director of the NGO Center for Health, Human Rights and Development, which advocates for the right to health, says safety was long pushed to the back burners.
Even those that have been refurbished have not taken recognition of the fact that things are more sophisticated now. You can't have a health facility without cameras. Babies are being lost in health facilities. As such, the safety of the mothers that are actually delivering themselves and the babies is not ensured. We've prosecuted cases where a national referral hospital is not able to actually track the babies that have been delivered before. And it has taken a lot of effort, advocacy efforts, for us to convince Mulago to actually install cameras and have systems of ensuring that babies are safe.
He says there are charters in place on patient safety, but this is hardly followed.
We think about safety as the last issue, and yet it ought to be the first issue. When you look at the guidance that the WHO has given, if a country was serious and it digested that guideline, it does not require much investment. What is required is to change in the way we operate. I think safety begins with changing in the way we operate, changing the mindset.
We have the patient charter I talked about, rights and responsibilities. This document has been in place for some years, but now we are coming up, I think, more strongly to educate the community and the people out there to know their rights. And actually there's a bill which is going to come up and address and regularize this issue of rights and responsibilities and everything.
So Ugandans should not sit and think that somebody is worrying about them. Ugandans need to be more proactive, need to be willing to demand for these services and to demand for accountability. And not simply to say somebody has stolen money, because sometimes maybe they haven't stolen money. Maybe they've just been plain incompetent. Maybe they've just bought the wrong things or haven't bought anything. We hear sometimes the money is seated on account somewhere. So we need to be much more insistent on where resources are going. And if the resources are not enough, why are they not enough? We are borrowing money. This is not something that we are just being given on a plate. We are going to have to pay back this money. And as I said, if we don't have health, if we are not alive and well, we are not going to enjoy anything else. So let's make this priority number one, to know why our health services are not better than they are.
According to a March 2021 semi-annual review report of implementation of the Ministry of Health's work plan for July to December during last financial year 2020-2021, several programs relating to patient safety are largely donor-funded, especially by USAID. The unit to follow up on safety compliance, the report details, has 12 officers sharing one office amid its lack of transport for fieldwork and delayed processing of funds for activities. The proliferation of private health facilities across the country to complement the moribund public health system makes regulation and follow-up to ensure adherence a challenge. Uganda's health infrastructure, according to the Health Ministry's estimates, consists of 6,937 health facilities, of which 3,133, that is about 45.16%, are government-owned, 2,976, about 42%, are private for-profit, a majority being in Kampala and the Central Region, and the rest are private not-for-profit. Several affected persons who have medical litigation cases either suffer in silence or refer complaints to the Uganda Medical and Dental Practitioners Council, the medical profession's umpire.
I have colleagues in Kenya, they normally have about 700, Tanzania 500. And I think because maybe the knowledge is, information is still low in Uganda, or the society is not very active, because we know those cases are there.
Dr. Sentongo said they averagely register 60 cases annually which are lodged against individuals.
Because there are negligences that are attributed to individuals. There are also negligence which is attributed to the system. Okay? These ones have to be segregated so that if there is a punishment or a reprimand, it is taken where it is supposed to be. But sometimes the public who are affected, they really think everything is on the health worker.
Punishments for both health workers and health facilities also vary, ranging from a warning to deregistering depending on the gravity of the offence. According to the last annual 2020 report, the professional body is constrained by lack of transport and infrastructure, office, logistics and funding. The recurrent complaints include unlicensed facilities, poor waste management, poor infection prevention and control practices, inadequate PPEs, poor prescription practices, poor record keeping, inadequate qualified staff for the services offered, and poor laboratories often providing inaccurate results.
To identify the problems which are caused by health workers so that we are held responsible, the weaknesses by the districts so that they are held responsible, and those ones which are for Ministry of Health so that they are held responsible. But sometimes they write stories and it mixes up and you don't, people who are supposed to be responsible, they get scot-free. And normally it follows on either a medical superintendent or a doctor who failed to operate when there was no gas and whatever.
Among cases investigated, medical negligence tops the list with 47, followed by professional misconduct, professional incompetence, abandonment, and professionalism, issuance of false medical reports, and illegal practice. There are also 16 cases related to fitness to practice, the principle that for one to practice, one must be physically and mentally sound, of which 6 health workers were found mentally unfit, 8 used drugs, and 5 abused alcohol. At Uganda General Hospital last September, a man posing as a security guard raped 6 women in a single day. The hospital offered immediate treatment against possible infections, especially HIV, and tried to conceal this scandal until NGOs drummed it up. 1 year later, security at the hospital remains lax, just like other hospitals we've visited. Even at private health facilities, no safety is guaranteed. Antenyi Namukwaya checked herself into St. Kizito Health Center 3 last year on August 28th to give birth. She came back home deeply traumatized by an unrelated episode that could shatter the life of her now 12-year-old stepdaughter. Shortly after giving birth, as the doctors let them to rest, with her stepdaughter, then aged 11, on the side, a man wielding a panga broke into the ward. Too weak and too numb, a shell-shocked Namukwaya gathered some strength to beg for mercy.
I was trembling and crying. That's when he told me to tell the girl to undress herself if we didn't want to get killed. I didn't have a choice. I told the girl to undress. I was about to scream, then he put a panga on my neck. When everyone came to the room,
the forceful penetration elicited a loud scream from the girl, attracting the attention of the midwife on duty and the hospital security, but the assailant fled. Police and area leaders were soon called to the scene. But prosecution of the suspect dragged.
Police yatuwe baluwa yayo PF3 ne bamukebera era ne kizuulibwa nti waliwo penetration omwana yakozesebwa.
Both the police and independent doctors confirmed that there was no penetration of the minor. The case proceeded only for the state attorney to tell us that there was no sufficient evidence that police didn't get semen both from the suspect and the girl. We wondered how semen could have been collected, yet the suspect didn't go far with the action. Either way, the case collapsed.
Regardless, both Namukwaya and her stepdaughter's lives were altered, says the husband.
I have been pushing the hospital to compensate for what happened to my people at their premise, but they refuse to cooperate. My wife is still psychologically tortured, while my daughter's life was forever altered, and her self-esteem was also affected.
The health center immediately treated the minor for sexually transmitted infections. They promised psychosocial help for both Namkwaya and the minor, but that was the last time they heard from them. Katumba said it is until he heard on radio a program on patient and healthcare awareness by one of the NGOs that he decided to seek their intervention to force St. Kizito Health Center to up responsibility.
We took St. Kizito and invited them for a meeting to amicably settle that case. We emphasized amicable settlement towards the facility. The Reverend Sisters came one day, and up to today, they have never come back to see that they settle with his family. Also, when you look at what happened, we asked them to provide psychosocial support. We knew that in their system, they have people who could provide psychosocial support to the family. As you've heard, no one came up.
We reached out to St. Kizito Health Center, which is church-based, for a comment on the matter, but got no response. But in the grand scheme of things, this is what majority of Ugandans go through and more daily to access better health care.
For challenges that occur or problems occurring in private facilities, the management takes the management of that local facility, it takes the immediate responsibility to address it, to see what has happened and why, and what needs to be done and how it should be prevented from occurring again. So that is one aspect. Then second, of course, there are the supervisory structures we ignored in the districts and also at the ministry here that are involved in that. But when there's a public outcry for a particular concern, then the ministry needs to get feedback.
So the charters and all these procedure things that are existing are important, but they must be put in practice. It's not also true that we do not have these things at the country level. We have actually documented and tried to incorporate many of these things. We worked with the Minister of Health to develop a gender and mainstreaming manual. What is in that gender and mainstreaming manual? Part of the components are to do with patient safety. The issue is putting them in practice, and the issue is changing the mindset.
The recent second wave of COVID-19 further exposed the fragilities of the country's public health system.
Ugandans should not be sitting back and thinking somebody's worrying about them, because they are not. It's become clear enough. As long as poor people were selling their goats and sheep in the villages to get onto an ambulance, as long as it was not affecting the wealthier people, there was no outcry. The outcry only came because some wealthier people were now being charged 40 million, were now being charged. But poor people were always suffering, were always dying for lack of an ambulance ride to the health center. They were always dying because they did not have, anesthesia in the hospital. They did not have very basic things.
In her first address to commemorate the World Patient Safety Day in 2019, Health Minister Jane Ruth Acheng noted that if healthcare itself poses a threat to people's health, the benefit of increased health coverage is completely lost, and that unsafe care erodes trust in public health systems and deters patients from seeking care. Public trust can only be restored if the country's healthcare system is properly equipped and senior government officials have the faith to seek treatment in the same facilities.